Okay, so I'm going to do my IV critique for hanging my secondary IV medications. So the first thing I would do would be to check my MAR against the doctor's orders. The patient is to receive cetazidime 2 grams IV every 8 hours from the Dr. Nora Jones. So once I have confirmed that, and it's been confirmed by 2 nurses, I would continue on. The next thing I would do would be to use the monograph supplied by the hospital or agency to find out about cetazidime before I give it. So cetazidime is a broad spectrum antibiotic of the cephalosporin family. Its onset is 5 minutes IV, and its half-life is about 3 to 4 hours. It's administered for severe infections, and it's come up pre-mixed from the pharmacy for me. It says to dilute it in 50 mils. This is 50 mils with an expiry date of February 2023, so that is good. And it says we can run it over 30 minutes. So the other thing we need to know is any allergic reactions, as well as if it can run with the fluid that the patient is running. So it says that you can have a reaction of fever, an allergic reaction, anaphylaxis, rash, phlebitis or pain at the site, as well as increase in serum creatinine levels and GI symptoms of nausea, vomiting, and diarrhea. According to the monograph, it is compatible with normal saline, which is what it's mixed here, and with what the patient has in his IV lines, currently running TKBO. So once that is all confirmed, then I will check the medication that came from pharmacy against the MAR. So I see it's for Robbie Robertson, unique number 075432. It's cetazidime 2 grams. It is ordered every 8 hours, and on the MAR it's ordered for 6, 2, and 10. We're giving it at 2 o'clock for infection, IV through his right hand. So I would check it again, just to make sure. It is Robbie Robertson, 075432. It is 2 grams of cetazidime every 8 hours. 6, 2, and 10, we're going to be giving it at 2 o'clock for his infection through his right IV site. The other thing to note from the patient's chart and my knowledge is that he does have an allergy to codeine. All right, so once I've done those 2 checks, because we're going to be hanging this via gravity, I will also calculate my drip factor, 50 mils over 30 minutes, and using the drip factor of 10 drops per minute. The math is 50 divided by 30 times 10, which is 16.6 or 17 drips a minute. If you were using an IV pump, you're giving 50 mils over 30 minutes, so it is, so you're going to run it at 100 mils an hour. All right, so once I have done all that, I'll take my medication, my secondary line, and alcohol swab, and go in and see my patient. So I'm going to go in, say hello to Mr. Robertson, ask him how he's doing. I'm going to confirm that his name is Robbie Robertson by using his unique band 075432. Ask him his date of birth, which he'll tell me. And I will tell him that he's getting ceftazidime 2 grams for his infection that he has. I would assess his IV site for phlebitis and infiltration. So I'm assessing for warmth and cool, swelling, redness, and pain at the site. He doesn't have any of that. There's no leakage. The lines are connected. I would check the lines to make sure that there's no kinks, that it's all connected right, and that the date on the line is within the last 72 hours. I would then scan Robbie's ID bracelet as well as the medication as a third check, and to record it into the MAR. if I was using an electronic MAR. So we're now going to hang our medication for Robbie. So the first thing I have to do is take out my secondary line. The primary line is clamped. I would clamp the secondary line, swab the port for about 15 seconds to make sure that there is nothing on it, and let it air dry. Once it's air dried, I'm going to connect the secondary line to the port. I'm going to open up the secondary line and drop it lower than the primary line so that there's no air bubbles in there. Once it's about halfway up into the chamber, I will connect, using sterile technique, my secondary bag to the line. If there was more than half, I could squeeze the chamber to get rid of it. I would use the blue hanger to drop my primary line lower than my secondary line. Hang my secondary line of medication. I would make sure my secondary line is unclamped and hold the primary line. Watching the secondary line chamber, I'm looking for 16 to 17 drops a minute, or about 4 drops in 15 seconds. One. Once it's established that it is at 17 drops a minute, I'm again going to tell the patient to call me if he feels any burning, itching, soreness at his IV site. Call if he has any GI upset, as well as tell him I'll be back in about 30 minutes when the infusion is done. Once I'm done with that, I will go to the MAR. If I was using my electronic MAR, I would then save it as documented on the chart. If I'm using a manual MAR, I'm going to put my initials down and also sign the signature sheet to ensure that my signature is on the patient's chart if it's manual. Thank you.